Now we're going to look at the second chapter of the Cannabis and CollegeHealth.com app. The second chapter is Ask. We'll open that up. What is the most important thing about asking patients about cannabis use? Not being afraid to ask. Some of these are my opinions, by the way. I should emphasize that. We'll get to the literature in a minute. What is the most common assessment of cannabis use in the outpatient clinic? In my experience, no assessment. The second most common assessment of cannabis use is minimizing. The patient has their own minimizing. That's not what we're discussing. This is the minimizing by the clinician. The chart reflects the minimization with comments like patient uses recreationally, patient uses socially, patient uses off and on, patient uses but doesn't have any problems, patient uses to help to get to sleep. These statements could be true, and they may be true, but the point is they're too vague and they don't contain enough information, and they're likely representing minimization, even though there may be some truth to it. Certainly further assessment and further documentation is needed in these cases. When there is an initial vague comment about cannabis use in the chart, what I most often find is that cannabis use is never mentioned again, or in an electronic medical record, the brief vague comment is just copied over to every subsequent note. Why is it hard to ask about cannabis use? And sometimes it is hard, and I have to confess, sometimes I don't ask about cannabis use. I have come up with a few reasons in my reflections that could be relevant. The first reason is if it's in the chart, I'll be held responsible. I don't think anybody says this overtly, but I think it's a factor in people's mind. I know it's a factor in my mind. Because given how harshly clinicians are judged on the chart, and I think clinicians are judged too harshly on the chart in many cases, this rationale is very understandable. However, it may not reduce the actual liability that you have, and it certainly won't help the patient. Another reason, I need to focus on real problems like depression. Again, maybe nobody says these things out loud. These are maybe unconscious motives or unclear or unknown motives. The evidence is clear, however, that regular cannabis use increases the risk of depression or can increase the risk of depression. Also, if the patient has depression, it is less likely to improve if continued use, and that refers to the study that we spoke about at the beginning of the presentation. I don't want to look like a controlling old person by telling young people they shouldn't use cannabis. At least that's a concern of mine. However, keep in mind, if you act like you know more than you do, you will be seen as a phony. It will be very clear if you're a phony. So if you don't know a lot, I would suggest being open about that. If you do know more, you can share that with the patient. But pretending to know more usually is very ineffective, and the professional seems like a phony, so to speak. If you look at the information in the No chapter of this app, I think you'll know plenty. That's my hope. Also, good treatment has nothing to do with control. Good treatment is about expertise and support. Another reason, the patient might feel bad about themselves if I ask them about cannabis. I've heard this reason, and I've also probably used it myself. Patients may feel badly about their substance use, but if you are avoiding the subject, or if I'm avoiding the subject, they will sense that, and they will lose trust in you because you're not asking. Also, not asking sends a message that the problem is really too big to be addressed, and it's better not discussed. Another reason I've heard is the patient is not going to tell the truth. That leads me to the next article I want to discuss. This article is in the Journal of Child and Adolescent Psychopharmacology, and it had an interesting result regarding telling the truth in cannabis use. Let's take a closer look. Again, if you look at the spinning asterisk, that will give you a link directly to the article and possibly to the full article itself. In this article, the researchers asked 207 teens and young adults about their cannabis use. Pretty good sample size. They have very good sample size, in my opinion. They obtained a urine drug sample from each person and asked them about their substance use. So, what percentage of teens and young adults told the truth to the professionals about their cannabis use? Might surprise you. They found that 97% of subjects told the truth. 97% of subjects who said they didn't use cannabis had a negative urine test. Pretty compelling. Now, for additional information, this I think is less impressive than it sounds at first because most of the subjects were not using cannabis, so that's why many of them were negative urine drug screen tests. However, it still suggests, at least to me, that most patients will tell the truth about using cannabis. That is, if there are no real consequences on the line. That's an important caveat. This supports the idea that you can ask patients about cannabis use, and they're likely to tell you the truth, and that a routine urine drug screen isn't really necessary, as long as there are no real consequences on the line, as I mentioned a moment ago. Urine drug screen for cannabis does have its role in certain situations, for instance, some, but not all rehab settings. But be aware, urine drug screen is easy to cheat, and you do need expertise not only in interpreting the results, in confirming the results, but really in deciding what to do clinically with those results. So urine drug screen is not as simple as just collecting urine. One interesting secondary finding of the study is that parents were not very aware when their teen young adult was using cannabis. That also reflects my clinical experience. So, how do you ask a patient about cannabis use, and what's important to know? This next article is called Cannabis Legalization in College Health. I think it's an excellent article, and it states it is fundamental that cannabis use be monitored by providers. There's the reference there if you'd like to see it. The article has 4 recommendations regarding asking patients about cannabis use. Number 1, there should be an initial history that includes substances used, age of first use, amount used, and mode of use. Reassessment at each visit. The article recommends an ongoing conversation on cannabis use. That's what I think is important as well. Use of motivational interview techniques, which I'm guessing you're familiar with, non-judgmental interviewing, curiosity about the patient's experiences. I do think there's a fine line between being professional curious to understand the person's substance use and not being a voyeur, just hearing about them to hear some interesting stories. That can also indirectly, I think, glamorize substance use. So being curious, being interested, but not being a voyeur. It's a fine line sometimes. Harm reduction, including the possibility that for some, abstaining will be the harm reduction approach that is most effective. Maybe not for all, but for some. Number 4, if additional substance use treatment is needed, patient must have some degree of motivation. Good substance use treatment actually creates and grows that motivation, actually, even if there is none initially. The professional should become aware of available treatment programs, and a clinic can develop its own expertise and resources for the clinic for substance use. It is my small hope that this app can perhaps be a reference for some professionals. I hope it can be. That's the goal. So the summary of this article's recommendations: make sure you ask about cannabis use. Make sure to ask at follow-up appointments. Don't ask and then forget about it. That happens a lot. Or not forget about it, choose not to ask. Number 3, encourage reduced use without judgment, including possibly total abstinence. And number 4, don't be afraid of substance use treatment. That's you as a professional. Many patients are afraid of substance use treatment because it's an anxiety experience. It's loss of control, the unfamiliar, etc., expensive, etc. But I think clinicians also can be afraid of substance use treatment if they haven't had a professional or personal experience with it. So that's listed in the article. Here's some tips I use when speaking to patients about substance use, cannabis specifically. I start, and this I think is in agreement with the article we just reviewed. I start with my standard 60-minute interview assessment. Sometimes it's more than 60 minutes. Sometimes it's 60 minutes plus an additional 30 minutes. It depends on independent specific features of the clinic and the encounter. The patient almost never mentions cannabis on their own. I referred to that briefly at the outset of this presentation. Near the end of the interview, I ask permission to ask about substance use. I'll say it like this: sometimes substance use relates to mental health and sometimes it doesn't. Can I ask you about cannabis and alcohol and other substances? Here I'm just writing cannabis, but you get the idea. The patient will always agree. I've never heard anybody decline. And now the subject is open without, in my opinion, very much awkwardness. Having gotten permission, I simply ask, do you use cannabis or another, or alcohol, other substances, etc. But right now we're talking about cannabis. If the patient says no, then my cannabis assessment is done. It's time to focus on other mental health concerns, the reason they're in the clinic. Anything but a no in my assessment is just getting started. The patient, in my experience, and take this with a grain of salt, but this is my observation, it's commonly the case it seems, the patient will make one attempt to avoid getting into the issue. They'll make one attempt to minimize. They won't lie or deny it. As I said earlier, patients very rarely do that if there's nothing real at stake. But they make a vague, minimizing statement, I think in the hopes that we'll move on to something else. So what I do is I ask the patient what they mean by their one attempt to avoid or minimize. It's usually they say not that often or something similar. I just ask them to clarify whatever vague or minimizing statement they've made. And that follow-up question by me will usually overcome their one single attempt at avoidance. Maybe patients will have more than one attempt, but I don't see that at all, or often at least. And now we can begin to talk about cannabis use. So now that we know about cannabis use from the first chapter, and now we've discussed the importance and approach and ideas behind asking about cannabis use and getting an understanding of their relationship and history with cannabis use, we can talk more about education, which is an aspect of treatment. This concludes this video. In a moment, we'll go to the next video. At least I'll go to the next video. Anybody's interested can go to the next video as well.